GreenLight Laser. This is part of a series of short videos to explain what an enlarged prostate, otherwise known as benign prostatic enlargement or BPE, is. This video highlights one of the surgical procedures called GreenLight Laser that may be suitable for you. The procedure is usually carried out under general anaesthetic, meaning you will be asleep during it. It can also be done using a spinal anaesthetic, meaning you will be awake and numb from the waist down. It takes 1 to 2 hours depending on the size of your prostate, and most patients go home on the same day as the operation. A scope, or thin tube, is inserted into the urethra. It has a camera which allows the surgeon to view the prostate and see where tissue needs to be removed. A thin laser is inserted through the scope, which heats the obstructing prostate tissue and vaporizes it, turning it to gas. The laser can also be used to stop any bleeding, if needed. As the tissue is vaporized, it is not possible to send any tissue to check for abnormal cells. Finally, the scope is removed and a catheter is put in place to drain urine and any blood from the bladder. This usually stays in for 2 to 3 days after surgery, meaning most patients go home with a catheter to be removed later. Some bleeding after the procedure is common. It is not unusual for your urine to have blood in it for the first 24 to 48 hours after removal of your catheter. And for some patients, blood may be seen in the urine for several weeks after the operation. At first, it may be painful to pass urine, and you may need to go more often than normal. This can settle within a few days, but for some, it may last for a couple of weeks. After the procedure, it is common to feel tired for 1 to 2 weeks, and you should avoid heavy lifting or straining. The long-term benefits of GreenLight Laser include symptom relief and improved urinary flow, no need for medication for enlarged prostate, and improved quality of life. Before the procedure, your clinician will talk to you about possible side effects. These include mild burning sensation when passing urine, increased frequency or urge to pass urine, blood in urine, urinary incontinence, which may be improved with pelvic floor exercises, urine infections, which require antibiotics. Most side effects resolve within 6 weeks. Around 30 to 50% of patients having this procedure will lose the ability to ejaculate semen. This is known as retrograde or dry ejaculation. It means semen is not ejaculated through the penis, but travels back into the bladder. It is not harmful, and sexual climax sensation remains, but it may feel different. A small number of patients, around 1 to 2 in every 100 patients, will suffer some deterioration in erectile function. This can be temporary or permanent, and medication can be prescribed to help reduce the issue. Your urology surgeon will discuss possible treatment options, including side effects, with you, based on your own personal circumstances. More information is available online, such as these websites. Please discuss any concerns you may have about your symptoms with your doctor.